So a lot of you guys are probably worried about COVID-19 or the coronavirus as it's most commonly known. And although the world is now starting to take control over the COVID-19 situation, there is still a real worry that there'll be a second wave or a recurrence of the COVID-19, which we've recently had. So I thought it'd be a good idea just to give you guys a simple or a brief overview of what COVID-19 exactly is, as well as some of the symptoms that a patient with COVID-19 may present with. So if you think that you may have these symptoms or a friend may have these symptoms, you can then recognize this and then get into contact with your own doctor or your own health center. So let's get straight to it. So I thought it'd be a good idea just to give you guys a brief overview of what a virus and a bacteria is, as I'm sure that these are the two most commonly heard of germs or pathogens that you guys have probably come across. There are other pathogens or germs as well, such as fungus or parasites, but I won't be discussing them today. So viruses are the smallest and the simplest life form known. They are 10 to 100 times smaller than bacteria. And I've included a picture here for you guys to see the differences between a virus and a bacteria, what they typically may look like under a microscope. The biggest difference between viruses and bacteria is that viruses must have a living host, like a plant or an animal or a human. This is in order to multiply inside the body, whilst most bacteria can grow on non-living surfaces. So now going into COVID-19, which belongs to the coronavirus family of infections. These infections typically occur in birds and mammals. However, over the last decade, there have been some outbreaks of infections in humans as well. Now, in terms of the symptoms that a patient with COVID-19 may present with, there's a wide range of symptoms, okay? And these can range from mild to severe symptoms. The other important thing to note is that the symptoms may appear 2 to 14 days after exposure to the virus. So what that means is that you may have COVID-19, you may have the infection, but you may not present with the symptoms. So you may not present with a fever, cough or cold until anywhere between 2 to 14 days after you've got the virus, okay? And you may present with one of these symptoms that I'm going to mention in a bit, or 2, 3, or all of them. So these symptoms include having a fever or chills, and this is feeling very warm, hot, maybe associated with sweating as well. You may have a cough, which is typically a dry cough. However, the cough may also be associated with producing a yellow or green phlegm, especially if the patient has a chest infection. This can sometimes lead to a more severe chest infection called a pneumonia. A patient may have a sore throat, which is just simply, I'm sure most of us have had a sore throat throughout our lives. This is just simply a feeling of pain or soreness inside the throat or the mouth. As well as going on to the next set of symptoms, I'm sure most of us have had these, which is a blocked nose, runny nose. So symptoms of a typical common cold. The other symptom that a patient may present with is a feeling of fatigue, which is a lack of energy, feeling drained. Also muscle or body aches. The reason that muscle and body aches occur is because of muscle inflammation or soreness, which is caused by the virus. The virus triggers an inflammatory response within our bodies through certain chemicals, which then signal our immune system, which is our defense system, to get to work. This in the early stages can also cause some muscle fiber breakdown. A patient may present with a headache, and interestingly, patients have also reported a new loss of taste or smell in up to 53% of cases, and you can check out my reference below for that. Some patients have reported gastrointestinal symptoms, which are symptoms related to the gut, such as a feeling of sickness or vomiting. And in one study, it was reported that these symptoms occur in 2 to 40% of patients affected with COVID-19. Some patients have reported having red inflamed eyes. These have been reported in up to 32% of patients infected with COVID-19. And again, you can check out the reference I've used below for that. And shortness of breath or difficulty in breathing is another set of symptoms which may indicate a more complicated case of COVID-19. Now, some of the more rarer symptoms or problems that have been reported include symptoms related to the heart, the brain, and some studies have even suggested that COVID-19 may predispose some patients to blood clots, but further research is needed in these areas. So guys, there you go. That was my first video. Please leave a comment in the section below about any worries that you may have about COVID-19 or anything else you'd like me to discuss about your general health. Please subscribe so that I can continue to bring you valuable medical content to your doorstep. Thank you.